Is it really necessary to have a psychedelic experience in order to become a psychedelic therapist? Health Canada may not agree. Welcome back to the integration session, everyone. My name is Dr. Elena Koning, and today we're going to be discussing some pressing issues surrounding psychedelic drug policy in Canada. For example, where are we headed with psychedelic drug regulation in Canada? What happened with the results of the Health Canada court case? How might the progression of psychedelic drug reform follow a similar path to cannabis? To unpack these questions, I'm joined by two guests who have been offering important public perspectives on these issues at the national scale. John Gilchrist, Director of Communications at TheraPsil, which is a nonprofit advocacy group working to expand access to psychedelic therapy, and Eugene Oscapella, lawyer, professor, and drug policy scholar at the University of Ottawa. We're going to chat about the recent federal court ruling involving Health Canada, the role of experiential training in psychedelic therapy, and what a responsible path forward might look like. Let's get into it. Hello, John and Eugene. Welcome to the podcast, and thank you so much for being here.
Thank you.
Thank you.
Of course. Let's start with an introduction. So I know both of you come from different professional backgrounds and bring sort of unique perspectives to the psychedelic field. So could you each just introduce yourselves and then share a little bit about how you became involved in this space? We can start with you, Eugene.
Okay, well, I'm a lawyer by training, so that's the sort of perspective that I bring to a lot of these issues. I've been working in drug law and policy reform for almost 40 years now. I've taught drug policy in the Department of Criminology at the University of Ottawa for over 25 years now. So my view is basically informed by law and by the way that our legal system, the legal structures we've built around many of the drugs that we've criminalized have actually caused significant harms to society.
Mm-hmm. Yes, thank you. And John, how about yourself?
Yeah, so I do not have decades of experience in this space, but I'm the Director of Communications at TheraPsil, so we advocate for legal access to psychedelic therapies. I came to the space about 4 years ago after hearing the story of Thomas Hartle, who was the first Canadian to legally use psilocybin-assisted therapy to help treat end-of-life anxiety. I saw the YouTube video that TheraPsil posted of Thomas and just his extraordinary journey using psilocybin. And at the time, I was kind of looking for something new to do. With my career, I was working in film, and it was a pretty intense environment. And the opportunity to work at an organization like TheraPsil came about after some volunteering. And yeah, that Thomas's story and the TheraPsil's team's goals really changed my life, and it sparked this deep commitment to support patients and practitioners and support psychedelic policy reform. And it really took off from there.
Mm-hmm. Great, thank you. Yeah, I had the pleasure of listening to Thomas speak at a conference a few years ago, so I'm also inspired by his story, and he's had a ripple effect, I feel like, throughout the field. But getting back to, you mentioned the drug policy, that'll sort of be the topic that we are speaking about today. So to provide some background for our listeners, I want to turn to you, Eugene, and your expertise in the field. So how would you, semi-briefly, characterize the evolution of Canada's psychedelic drug policy over the past, let's say, like 15 years? And how does this compare to different controlled substances and their regulatory trajectories as well?
Okay, we can answer this in 3 to 4 weeks. Essentially, what we've seen in the last 10 to 15 years, I think, is an opening to a willingness to go ahead and look at new therapies using substances that have been, identified by the criminal law and by politicians and by many critics of these drugs as being irretrievably awful and harmful with no therapeutic benefits whatsoever. That has changed. I think medical cannabis started the ball rolling on that. And of course, we look back 75, 80 years ago, we did have there were studies being done with LSD in Weyburn, Saskatchewan. Actually, it was one of the leaders in the world looking at the possible use of psychedelics for therapeutic purposes. But we've essentially criminalized a lot of these drugs over the years, and it's only recently that we've begun to realize that some of the solutions we've looked for some of the intractable problems we have in society, addiction, some forms of mental illness, could be helped by some of these substances. So I think there's more of an openness now. It's partly political, because traditionally, I mean, the liberals and the conservatives were both bad on drug policy issues for decades. But the liberals became more small L liberal about this, and they became more open to looking at possible therapeutic uses. I mean, it was under a liberal government that we got access to medical cannabis. The conservative government that followed that tried to shut down things like supervised injection sites. They were clearly going back on a more punitive prohibitionist bent. But we've seen in the past 10, 15 years a real, I think, an opening up to have a sensible discussion, I call it rational pharmacology if you want, about the benefits of certain substances and the harms of certain substances. How do we maximize the benefits and minimize the harms?
Yeah, definitely important. Thank you for walking us through that. And we'll definitely get into as well later on in the parallels between this progression of psychedelic drug policy reform and that of cannabis, because I think you can draw a few parallels there. But let's talk a bit about TheraPsil, John. So can
Sure
you
thing.
tell us what is experiential training, and why do you believe it's important for healthcare professionals who might want to deliver psychedelic therapy?
Sure. So experiential training in the context of TheraPsil psychedelic training is the practitioners actually using the substances that they will then treat patients with themselves. And this is something that TheraPsil, as well as many other organizations, advocate for. Some, like TheraPsil, a little bit more explicitly. It seems to me that there's some form of experiential training with every psychedelic training, but really this is practical insights into the medicines that the practitioners will work with. And from our perspective, this increases safety, absolutely empathy, and confidence in real world clinical settings. Moreover, for the patients, what we've discovered is that they get comfort from knowing that the person that is delivering their therapies has been where they are going. And in many cases, these psychedelic experiences are both some of the most spiritually significant and challenging of the patient's lives. And the idea that their practitioner has already been there, can relate to them, it gives the patient a lot of comfort. And that's not to say that there aren't risks inherent in this as well. There has to be structure and support and screening and supervision. And that's why we follow very strict protocols, and why a regulated system for practitioners is so important. It allows us to ensure that there's ethical boundaries and that we can reduce risk. Yeah. And when I said that other organizations would also agree with this, I mean, if you look at other psychedelic trainings, there's some sort of experiential component, typically, whether this is through holotropic breath work or through cannabis use. It does happen. TheraPsil just takes it to the degree that we believe is the most safe and the most ethical for the patients who will be treated by these practitioners. Yeah, and it's something that we've advocated for since the very start of these training programs back in 2020.
Yeah, thank you. And I know that the experiential training in the scientific literature is a little bit of like a mixed area. Some people say you need to have your own experience in order to be a psychedelic therapist, and others say it's not necessary. And others have even criticized it in a way where they say it might blur professional boundaries or undermine clinical objectivity. So, how do you respond to some of those concerns, and do you think those are valid?
Sure, I've heard this point before. I mean, I understand the concern about objectivity, but in my view, the far bigger risk is sending practitioners into this work with no personal understanding and no personal work with the substances. I mean, you wouldn't train a scuba diver who's never been underwater, and psychedelic therapy to me is no different. Um, I mean, that is also our clinical model at TheraPsil, and typically I interview practitioners um, at the onset of their training to establish their fit with TheraPsil. And I'd say in 4 out of 5, perhaps even more, percentage wise, practitioners would say one of the main reasons that they're coming to train with TheraPsil is precisely because we have this experiential unit within the training, and that's something they're not going to get from other institutions. And yeah, again, I do think the point is valid, but I also think that as soon as there is a regulated system, every other training institution will start with experiential training with the substances that they're training with.
Okay, thank you. And Eugene, turning back to the legal side of things, now that experiential training, there's more interest in it, what are sort of the biggest regulatory and structural barriers that are standing in the way of that kind of training happening?
Well, first of all, possession of, if we're talking strictly of psilocybin, it's illegal under the Controlled Drugs and Substances Act. Transporting it, importing it, giving it to others are all illegal. So essentially what you need is an exemption from the existing law. It is not illegal. We speak colloquially of using drugs being illegal, but the use of drugs is not illegal in this country. It is illegal in some U.S. states and in some other countries. Singapore, for example, you can be prosecuted for using a drug, but technically in Canada, the use of the drug is not illegal. It's the possession, which, and then maybe to some people some people may think it's a distinction without a difference, but I always like to remind people that the actual use is not illegal. It's the possession, the sharing, the import, the export. So what we need is a mechanism, and we have that in the Controlled Drugs and Substances Act under Section 56 of the legislation that allows the minister it was the Minister of Health, now it's the Minister of Addictions, to exempt any person or class of persons from the application of any of the provisions in the law. So that's one vehicle for getting access to it, and that in fact was the method I understood that TheraPsil used before to get access to cannabis for experiential, or not cannabis, for psilocybin for experiential training, if I'm not mistaken.
That's right.
Thank you. And yeah, you mentioned earlier the sort of demonization of certain substances. And I think when we talk about psychedelics as controlled substances, it's kind of important to frame the historical and the cultural context that's how that designation came about. So how has that historical demonization of psychedelics contributed to these obstacles in your view?
Well, anytime you've got something, essentially it goes back to the origins of the criminal law. We normally use the criminal law to deal with behaviors that are considered seriously antisocial, for which other regulatory mechanisms or social mechanisms aren't appropriate. Well, in the 1960s, there was a lot of concern about LSD, for example. That was the one, and there were a lot of very lurid stories about people taking LSD and strolling out in the middle of the highway naked and things like this. So there was a lot of concern about that, and the reaction at the time was, let's go ahead and criminalize it because the criminal law will resolve the problem. That's how we got to where we are, and unfortunately, using the criminal law creates its own sense of morality, because probably to most people, if they hear that something has been made criminal, they'll think, well, the government must have made it criminal for a reason, and therefore it must be bad. And in fact, many of the actions by the governments, past and present, in relation to our to drugs in this country, have not been based on common sense. They've been based on prejudice, discrimination, private interests and things like that, political advantage. They've had very little to do often with actually promoting the public welfare. So that's the environment we've been dealing with for many, many decades.
Yeah, definitely an important point. And so we have all these barriers that are making it difficult to access psychedelics, but there is this pathway, this special access program. So that leads me to this sort of confusing response by Health Canada to these applications. So from my understanding, in 2020, TheraPsil was granted exemptions for healthcare workers to undergo experiential training. But then in 2022, there were very similar applications that were then denied, and there wasn't really concrete reasoning as to why. So that brought on the Federal Court of Appeal. So either of you, we can start with John. Want to speak to sort of the result of that ruling and your thoughts about that case?
Sure, yeah. So yes, in 2020, following the first Section 56 exemptions for patients, one of whom was Thomas Hartle, who we spoke about earlier, TheraPsil began applying on behalf of practitioners engaged in the training for the exact same reasons. And the health minister at that time, Patty Hajdu, she showed real courage. She responded to real patient suffering and allowed for Section 56 exemptions, not just for patients, but also for healthcare practitioners who needed this firsthand experience to support these patients. And important to note that she was listening to the experts that Health Canada had actually hired, that they brought on to establish the need for practitioner training. And they unanimously determined that it was essential. And we've seen this in the discovery of this case. We can see internal emails from Health Canada back and forth. We've hired this team to determine the necessity for experiential training. And then the response is, yes, we agree, it is necessary. You should grant these exemptions. But then by 2022, as you pointed out, that openness and that courage seemed to have disappeared under the no longer was Patty Hajdu, it was a different health minister at that time. And Health Canada's denial letters, the minister's letters, began claiming that there was insufficient evidence that experiential training was necessary, even though they had previously approved it and seen it work safely. So this felt like a reversal under political pressure, not science-based decision. And I think it just pointed to a deeper issue that psychedelic therapy is still politically uncomfortable. And rather than take a leadership role in shaping potentially safe and regulated access, the approach by Health Canada seemed more concerned with avoiding controversy. And TheraPsil is a very small grassroots organization, and we stick by our guns. And we brought this issue to the courts. We wanted a judge to determine, why is it really that these exemptions are being denied? We're not getting a good reason from the minister. And about, what are we, July, so 3.5 years after initially launching this and the judicial review, making it all the way to the Federal Court of Appeals, we had a judge claim or say, rather, that these decisions, which are now over 200 practitioners, to deny them access to psilocybin was unreasonable based on the previous approvals. So this has now been sent back to the current Minister of Health, Marjorie Michel, to reissue decisions. And forgive me, I don't know the exact amount, but it's over 200 practitioners. I think it's worth pointing out as well that TheraPsil would provide a safe container with decades of experience in psychedelic therapy for practitioners to undergo this component of their training. Meanwhile, there are dozens and dozens of not just online retailers, but brick and mortar stores where any ordinary Canadian can go in and purchase illicit psilocybin and other psychedelics. So why not align with science and compassion and the country's leading psychedelic therapy nonprofit in TheraPsil to do the right thing here, to align with science and the decisions that were already made by the previous health minister. So yeah, we'll see what the minister does now that she's been compelled to reissue these decisions. But I think that the political pressure is not really aligning, or rather the political motivation is not aligning with what the science keeps confirming, that psychedelics are potentially safe and effective.
Mm-hmm.
I certainly agree. If I may just interject for a second here, John, I agree with you that politics is often a big player in all this. What the court said in the end of the day was that, look, the minister has the discretion whether or not to allow access under the Section 56, but she hasn't explained, or the previous minister, it was the previous minister, had not explained adequately the reason for changing the position on this. So, governments can change their views based on new evidence or whatever. But this court said, well, look, you haven't given a justification for, an adequate justification for changing this application of your discretion. Your discretion isn't something that you can just use on a whim. It's not some sort of Trumpian sort of power that you have just to go ahead and say that I'm going to change my mind. You have to have a reason for it. And that was the big flaw in this the case as I read it, is that they hadn't given adequate reasons, and that's one of the reasons, as you say, it was sent back. So we're now waiting. Is there going to be a different reason? And on the political side of things, there clearly this is a sensitive issue. To talk about psychedelics for a certain sector of the Canadian population is anathema. The therapeutic use or recreational use or whatever. They're going to argue that the world is going to hell in a handbasket. So politicians, even if they want to be supportive, sometimes are caught in a very, very difficult position.
Mm-hmm. Yeah, and so both of you sort of agree that there's more to this decision than simply the scientific evidence base. There might be political reasons involved. So do you think that...
Well, there might be, but we can't, I don't know what was in the minds of the bureaucrats at Health Canada, and I've worked around government for decades, and I think most people are well-intentioned. I don't know what's in their minds, but what the court said is that if you're going to change your mind, you have to explain why.
Right.
So, and so we are left at this point sort of speculating as to, was it political, to what extent was it political, what other forces may have been at play, that, was there new scientific evidence that they're relying on. If whatever the case, make that more public so that we can assess the validity of that argument.
Right. And I did see a quote from the ministry that read, Health Canada is not aware of peer-reviewed clinical evidence to demonstrate that healthcare professionals need to take a psychedelic drug in order to appreciate what the patient experiences. So do you think that regardless of the evidence for safety in individuals, do you think that Health Canada is being a bit too stringent with that sort of rationale?
I'm not a lawyer, or I am a lawyer. I'm not a pharmacologist or a psychotherapist, so that's not a question I'm at all capable of answering.
Right.
I'll leave that to you, John.
Yeah, well, I would just bring it back to the experts that Health Canada hired 5 years ago, who unanimously determined that it was essential. Mm-hmm. So, of course, more peer-reviewed clinical evidence is amazing, and we should be investing in that. However, we're talking about a mushroom, and we're talking about something that our government approved many years ago. And to renege on these decisions with, as the judge said, with an unreasonable determination, I really think it's a bit of a reframe here in how we're talking about psychedelics, and to put them on this pedestal is, I think, a bit unnecessary in this case.
Mm-hmm. Yeah, and I agree with how it's sort of tricky and can have negative public health and safety effects as a result. So in a way, this can sort of, like, not allowing legal access to psychedelics could contribute to potentially increased underground use. So do you think that is a negative consequence of these actions by the government?
Well, I can point to the latest iteration of the Canadian Substance Use Act, the Canadian Substance Use Report, which came out at the end of 2024, which showed the substance use for 2023, which showed a near 200% increase in psychedelics use from 2019. And this is obvious. I mean, I live here in Toronto. We've got dozens of stores that are operating here that you needn't provide any sort of identification to get access to psychedelics. So, in terms of like balancing the safety to restrict legal use, which is what we're seeing. Meanwhile, the underground, like illicit use of psychedelics is dramatically increasing. That's a very strange world to me, mm-hmm. where a terminal cancer patient can't get the help they need from their physician or their healthcare team, and yet any ordinary Canadian can go purchase these things.
Yeah.
You're right. Historically, we've had, I mean, one of the consequences of using the criminal law to prohibit drugs is that you drive the market underground. And that means that the use that occurs is more dangerous than it would otherwise be. So you get people injecting heroin because it's very expensive to buy on the black market, and injecting is a more efficient way of using it, but they don't get the proper education about how to use it safely, because we don't want to educate people about something that we consider to be illegal or improper. And I mean, there's a long history of this with the education about sex education, for example. We didn't want to tell people about it because we were afraid they might do it. So what we did is we left them to do it uninformed. So that's one of the real consequences. There's a delicate balance between accepting the reality of the use of many different psychoactive substances in society, and I suspect that all of us use some of them, whether it be caffeine or theobromines in tea, or alcohol, or some people are using nicotine, and maybe some of the other now legal and illegal substances. We're all doing it. If people are going to use it, they need sensible education about how to do it safely, to minimize the risks. And that goes back to my original point. How do you minimize the risks of these substances and maximize the benefits? And by driving the market underground, you tend to maximize the risks, because the people who are going to sell it aren't as worried about quality control. Which is why you have people dying from fentanyl overdoses in other situations, because the people who are trafficking the drug are interested in making money. They're not interested in quality control. So we need we need education, we need effective quality controls, and that's done under a regulatory system best, not under a system based on the use of the criminal law.
Mm-hmm. Yeah, I definitely agree with you both on that. And Eugene, do you think that this current exemption-based model that we have right now under the Controlled Drugs and Substances Act, do you think that's sustainable long-term, or are we inevitably moving towards sort of like a broader, like you mentioned, regulatory framework for psychedelics?
Well, I mean, 120 years ago, cocaine was legal in this country, cannabis was legal in this country, opium, heroin were legal in this country. Go down to the pharmacy and buy your Bayer heroin. So we could, in theory, move to a system where you have only regulatory controls about quality and labeling, as we do with coffee. You buy a pound of coffee, it's got caffeine in it. There's enough caffeine in a pound of coffee to kill you. But if you process it down, what do? We have bilingual labels. We have the product has to weigh, it has to contain however much it says it contains. There are those sorts of regulatory controls. That's one possible way of going, but that's not going to happen anytime soon. I think we're opening up to the more studies about the therapeutic use of many substances. But it's not going to happen quickly, because the political pushback. Remember, we've had over 100 years of argument that our drug laws are necessary because drugs are inherently evil, and you can't just go ahead and sort of back out of the thicket that we've created and say, oh, we've changed our minds. You can't do that. And especially since there will be political opposition, very strong political opposition to doing that. And there's a small c conservative section of Canadian society that says, look, I'm worried about people altering their state of consciousness like this. And politicians, in a world of real politics, they have to pay attention to this. So I don't think it's going to open up massively anytime soon. But I think intelligent approaches, we've seen a significant opening up over the past 10 or 15 years, like we were talking about earlier. I think that's the way it's going to happen, but I don't see a massive shift to a new regulatory regime right now. I think it's going to be piecemeal. You're going to go to the minister with an application, or go to Health Canada with a proposal for a study, and it's going to be done on an individual basis. And then maybe gradually, as society can see some of the benefits of the the products of these studies, maybe then the process will become easier. But right now we're still dealing with the hangover of very hostile prohibitionist attitudes towards certain psychoactive substances.
If I can jump into, I mean, I completely agree. But to the point about the potential sustainability of this exemption model, I think there's zero sustainability here. It's absolutely, and with TheraPsil, we see this truly every day with the patients that we're trying to support. This program is arbitrary. It's opaque. It leaves patients in limbo. Some get approved, others with the same diagnosis and clinician support are denied. So it seems more like a lottery than a health system. And we're now at a point where Canadians with terminal cancer and other severe conditions are traveling to Jamaica or Mexico or the Netherlands or the United States, for goodness sake. You can go to Oregon or Colorado to seek psychedelic therapy when they should be able to access it safely here at home. So it's a two-tiered system. It's one for those who can afford to go abroad or afford a lawyer, like someone that we have at TheraPsil, to actually bring this issue to the courts, or you're forced to suffer or turn underground and do this illegally. So we won't see any improvement here until we remove this exemption system, until everybody is treated the same, and there needn't be government approval to access something like psychedelics. And I realize this is idealistic, especially after what Eugene has just said, but if we're following a trajectory of hopefully compassionate access and following science, we are there already. And if we have a doctor and a healthcare team that believe that psychedelics and psychedelic therapy are an option for their patient, then that should be the end of the story. People go to school for this for a reason, and we cannot have bureaucrats looking at a rubric of the extent to which someone is dying, and that should qualify them to use a mushroom that might be growing in their backyard and they don't even know about it. So I think we really, and I also just want to mention as well, this is, again, I realize maybe a bit of a duh moment, but in terms of like reframing, we talk about this sometimes at our organization, like how we talk about psychedelics and the like substances like psilocybin, which are currently illegal, yet substances like alcohol, which are clinically proven to be addictive, contributing to thousands of deaths annually, are fully legal and widely available. And antidepressants prescribed every day, often for many of the patients we're supporting with limited long-term benefit. Yet psychedelics, which show strong evidence for potentially reducing depression, end-of-life anxiety, even addiction, these remain out of reach. So it's the real issue, I don't think, is risk. It's just discomfort. Discomfort with altered states.
And John, I agree with you in a lot of that. We can talk about rational pharmacology, and you've just given a bunch of examples of how in many ways it's completely irrational. That alcohol is one of the most dangerous drugs, and there are many others that are far less harmful, and many prescription drugs can be very, very harmful as well. I mean, some of the NSAIDs can be very, very harmful and cause a fair number of deaths in this country every year. So we need to have that discussion, a rational discussion about going back to what are the benefits, what are the harms. But it's been so politicized, and there's so many vested interests in the process too. And I go back to when we were trying to push for legal access to medical cannabis. Well, pharmaceutical companies, in the case that I was involved in, was a fellow who was essentially starving to death. He had AIDS. He was probably within months of dying, and he was being given anti-nausea medication, expensive prescription anti-nausea medication, when the cannabis would probably work just as effectively for pennies. But you've got a pharmaceutical company that makes an enormous amount of money selling this expensive pharmaceutical product. So you've got vested interests at play here too. And of course you've also got groups like organized crime, which we haven't talked about, but organized crime has been heavily involved in the drug trade ever since it was made illegal. And they don't want prohibition to end either. So there are a whole bunch of players who you've got politicians who are afraid to move. You've got bureaucracies that are built around this sort of sclerotic model that we've been discussing here today. There are a lot of vested interests that don't serve the public interest, but that serve individual interest, and those have to be displaced. And that's one of the great challenges with drug law reform in general, not just with the work that you're doing, John, but and your work on psychedelics in general. It's one of the problems we have to face is there are a lot of vested interest in the status quo, and it's not for the public interest that they're vested interest. It's for their own interest, despite the harm to the public interest.
Yeah, definitely. Yeah, thank you. And I really appreciate those perspectives, and it really speaks to how many factors are truly involved in this beyond just considering the public health benefit. And thank you for bringing up your involvement, Eugene, in the efforts to expand medical cannabis. So I just want to briefly, before we move on, because I do want to talk about TheraPsil and the work that you guys are doing a little bit more, do you see sort of like what is your time horizon for viewing psychedelic policy reform alongside the parallel of cannabis in terms of medicalization as a stepping stone towards full legalization? Do you think it's even way too soon to even think about that?
Well, it's hard to talk about full legalization. There are always going to be regulatory controls. I mean, I was working, and I was only one of many, 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 many thousands of people working internationally to go ahead and change our drug laws. And for 30 years, nothing happened. And then we've seen a lot of movement with cannabis in Canada, in the United States, and many other countries. And with psychedelics now we're seeing more, but it's hard to to identify the factor that's going to be the tripwire that's going to really make things speed up. It seemed like with cannabis for a long time we were fighting, and then all of a sudden the door opened. And that may well happen with psychedelics as well. Although I think the process right now it's a bit more rational than it used to be. So it's not as if everybody hates this stuff and we're all of a sudden going to change our minds on it. There's been a gradual education process, an earnest desire to look for means to address some of the very real problems we face in our society through the use of some of these substances. So I don't think it's going to happen quickly, but it may happen more steadily now.
Okay, thank you. And John, turning to TheraPsil, how important are grassroots advocacy organizations like TheraPsil in driving policy change? Do you think that TheraPsil has the power to make progress here? And then what does that relationship look like with like the clinical or academic research as well? Do you think they're inherently dependent on each other?
Yeah, going in reverse, I think they complement each other. TheraPsil launched its training programs, began advocating for patients based on clinical research. Obviously the research conducted in the 1950s and 1960s, as well as seminal studies from UCLA, Johns Hopkins, and New York University. And yeah, grassroots advocacy is essential. TheraPsil didn't wait for permission to start helping people. We just stepped in when no one else would. And we really started in these advocacy initiatives because we realized that the access mechanisms for psychedelics were more difficult and opaque than medical assistance in dying here in Canada, that the latter was becoming liberalized while the former was not, and one of them has to come before the other. We're not working against science either here. We're working with it and complementing it, as I said. Like, patients don't have time to wait for 10, 20 years of clinical research to determine the extent to which psychedelics are safe. What we've already seen is that they are safe, and safer than Advil. Our movement here is fueled by patient stories and practitioners' voices and compassion. And for the point of research, like, we collaborate with researchers and clinicians because real progress does happen when grassroots advocacy and academia work together. Many of the trainers and the practitioners that are in our community are academics and come from that space. So yeah, I think not to toot our horn too hard here, but in terms of the results, I think they speak for themselves with what TheraPsil's been able to achieve in the last 5 or 6 years. We've seen these federal court cases be brought with a shoestring that we run on here. with community advocates and generous individual donors. So yeah, I mean, this case that we're talking about at the federal court is just one of many that we have brought up and won. So I'd reference Jody Lance, who's a Canadian Calgarian with suffering from cluster headaches, who was denied access to psilocybin to treat his cluster headaches, which he was supported. His application was supported by a chronic pain expert, a neurologist, and the message was, there's not enough evidence to show that this will help you. Meanwhile, he's a MAID candidate. And so that's the advocacy. We bring it to the courts. We have a judge look at this and say, what is going on? And all these little victories, I think, are leading towards something more substantial.
I was going to say, what you're talking about, John, is very much the model that was used for medical cannabis.
Exactly.
It was a grassroots movement, court cases over a number of years, and bit by bit it chipped away at the resistance to it. And and we will find, we're going to learn something about some of these substances that maybe we think that they're fine in one context, and research may show that, well, they may cause harms in some contexts. Then you have to be willing to accept that and then adjust the treatment of the substance in that case. But that's all about the process, and it's bit by bit, and it's committed people who are willing to stick their necks out.
Yeah, important work that you guys are doing.
Yeah, well, thank you, and not to, I agree completely that the trajectory is very similar. It's striking with the exemptions, with the increasing pressure in the courts, with advocates, and not to dig on cannabis, which I will stand up for any day, but the psychedelics are now backed by stronger medical and clinical evidence than cannabis was at the time when it was legalized. And I think the key difference there is just that most people aren't using cannabis through the medical system, which is what TheraPsil, they're obviously not everyone that's using the 1.9 million Canadians I referenced who would use a psychedelic in 2023. Not all those people are using them for medical reasons. They can be pretty fun to use outside of that context as well. But the people that we're representing, that we're supporting, they only can access this through the medical system. So psychedelics are the same, but very different as well with cannabis. But I think the lesson is that we don't let the courts build the framework for you. It's being proactive and being clear and building a system that's credible and accessible.
Well, the challenge is there has to be a gatekeeper somewhere for some of this stuff, and what goes into the mix. You've got research, you've got medical practitioners, you've got government regulators, you've got politicians. There's all these players have to come in, and they all have to figure into the mix of doing this, and that's the challenge. That's the enormous challenge. And we're talking about a couple of substances here. There are hundreds and hundreds and hundreds of substances listed in the schedules to the Controlled Drugs and Substances Act, and many of which will have therapeutic benefits in certain contexts. So this is this requires a whole rethinking of how we deal with drugs in our world.
And looking ahead now, politically, legally, culturally, what needs to happen for Canada to build a more compassionate and also evidence-based pathway to psychedelic care? I would love to briefly hear from both of you about that.
Go ahead, John.
Well, I'd say the framework is one that prioritizes safety, education, and accessibility. So from our perspective, that starts first with legal therapeutic access through trained professionals. Just like you would regulate anesthesia, psychotherapy, one thing that we keep hearing is that the lack of standard training and treatment is an issue. And so that's why TheraPsil, we've proposed regulations. We have this training program that's trained over 800 people and patients who are ready and willing to start working with them, but face the barriers inherent in the special access program and other exemption schemes. And for that point, it's experiential training and licensing for healthcare practitioners. So we wouldn't let surgeons operate without hands-on training, so why should we expect anything less of practitioners seeking to work with something as complex and relatively novel as psychedelic therapy? And then I'd say as well is potentially the decriminalization for personal use, so that people aren't pushed into potentially unsafe underground settings are criminalized for using a mushroom. Like that, it's something that, again, is as a bit of a reframe. Like I was recently in British Columbia, and there's a sign saying, warning, some of these mushrooms are psilocybin mushrooms, wild in the forest. I would challenge anyone that works in our governing health body to say that is a psilocybin mushroom and that one isn't. They don't know. So a bit of a decriminalization of nature, let's say, that perspective I think is worth exploring. And then really at the end, I would say it's just clear ethical guidelines for harm reduction and education for clinicians and the public. These are things that we're restricted from talking about as an organization, and people aren't getting the information from Health Canada. So they need those resources. So just more education, legal therapeutic access, experiential training, and some common sense decriminalization. I just to finish, I'll say it was strange to us when the province of British Columbia enacted the Section 56 exemption, decriminalizing opioids, fentanyl, and that made a lot of sense to us. What didn't make a lot of sense was psilocybin being left off that decrim list. And when we prodded, why is it that you didn't include psilocybin here? The answer we essentially got was, well, it's not harmful. It's not killing people. And so that was really confusing.
That was the environment at the time in BC, because people were dropping dead at the tune of 3 or 4. It was a terrible scourge right across the country. So that's part of it. I agree totally with you, John, about education and public education of the professions too, because physicians and they, I don't know if it's changed recently, but traditionally they've had very, very little training about pharmacology. Very, very little training about that. I have one caution, and that's that when we talk of something as a natural substance, because some natural substances can be harmful. So it's really the intelligent use of them. I mean, poison ivy is not a whole lot of fun. It's a natural substance. And maybe there's a therapeutic use for poison ivy. We just have to be careful, because that was quite often the argument that was made with cannabis, that, it's a natural herb, and therefore we shouldn't be criminalizing it. I think even natural products can be harmful. The thing is, how do we maximize the benefits of those natural substances and minimize the harms associated with them? But certainly some of the chemical concoctions that society has created can be horrifically harmful, and so the natural products seem a lot less harmful by comparison. But still, we have to be careful when we're dealing with them, because some aspects of their use can be harmful, and we just have to keep that in mind as well. But I fully agree that education is absolutely key, and honesty, because one of the problems we've had with drug policy, one of the reasons 30 years ago I helped form an organization called the Canadian Foundation for Drug Policy, was to challenge government propaganda and the propaganda of the pharmaceutical industry, because there wasn't an alternative voice to actually go ahead and say, no, that's not true. And that's what we need. And we need more people. And the internet, for all the harms of misinformation on the internet, it can also be a good vehicle for getting honest information out.
Mm-hmm.
I'd also just like to mention as well that while it seems like there is kind of this meme that we've been sold about psychedelics and their hippie dropout drugs. I mean, I could tell you the stories of what my parents said when I started working for TheraPsil, as you might expect. But again, it's the presentation of the evidence that we have. TheraPsil's conducted polls that show that 80% of Canadians would like to see psilocybin-assisted therapy made legal and regulated for people in medical need. So like the drive is there, and I think that's evidenced by the amount of people that are using them and seeking to use them. Everyone and their grandma is interested in microdosing, and yet they can't get information anywhere. Certainly not the Health Canada. And I also wanted to mention as well, I left out critically in building this evidence-based pathway for psychedelic care. There's a parallel respect for Indigenous sovereignty, because these medicines have predate what we call Canada. They've been used in ceremony long before Canada has ever existed. So I also think these communities and nations shouldn't have to seek approval from these colonial systems that we have, and continue their healing traditions. I think that's important to note as well.
Yeah, important point for sure. Thanks, John. And okay, last question for you both. So if you could each deliver one message to the Health Minister or to Health Canada, what would that be?
Go ahead, John.
I would say quite a few things to the Minister of Health.
All of them polite.
Yes. Well, I mean,
Yeah.
again, it's something that we talk about, that like in our communications, that like minister, please do the right thing, please do the right thing, that we in some way are villainizing our ministers, when no, they are our friends, and we have many friends that work at these institutions. If I had the Minister of Health in a room, I would present the regulations that TheraPsil has written and proposed. I would bring a very thick textbook of clinical evidence pointing to the what we currently have, showing the safety and efficacy of psychedelics in the treatment of certain mental and physical health conditions. But more than anything, I think I would speak to her compassion, and this is something that we have heard about this current minister, that she is a very smart person, and it doesn't take too much to realize that people are suffering and dying while waiting for access to something that could relieve their pain. The science is there, the precedent is there. What's missing, dear minister, is the political will to trust healthcare professionals to deliver this care safely. So my message would be to stop gatekeeping compassion, start regulating access, and not denying it.
Thank you. Eugene?
Well, my message would be just a bit tangential, but very much the same thing. Look, here's the evidence. We will support you. We know that you're going to face political opposition if you try to do the right thing in some circumstances. You're going to face political opposition. We will stand with you and support you with the evidence to go ahead and help you get this sort of move these ideas forward. I think that's very key, so that it doesn't look like we're opposing them, but very much that we're there to inform them, to help educate the public, which is a big part of it. And we will stand with you and help you move this forward. We're not going to abandon you if you do the right thing.
All right. Thank you both so much. This has been one of my favorite conversations, honestly, that we've had on the podcast. And it was a pleasure, and I really hope that this reaches the right ears.
Well, thank you.
Thank you so much for having me.
Very nice meeting both of you.
Thank you so much for listening to this fascinating conversation about psychedelic drug policy reform with John Gilchrist and Eugene Oscapella. As always, I'd like to thank the Centre for Psychedelics Health and Research at Queen's University and the support of our sponsors at the Ontario Brain Institute, the Canadian Biomarker Integration Network in Depression, and Providence Care Hospital. Until next time, be well and integrate wisely.